Understanding fatty liver disease, causes, and how to manage it. Welcome to our educational video on fatty liver disease. Did you know that your liver is one of the most vital organs in your body, responsible for filtering toxins, aiding digestion, and storing energy? But when fat builds up in the liver, it can lead to a condition called fatty liver disease. In this video, we'll explore what fatty liver is, its causes, symptoms, and how you can manage or even reverse it. Let's get started. Stick to the video till end, because in the end, I am going to give a bonus tip. I'll tell you about a most wonderful home remedy that will work as a magic to remove fat from your liver. What is fatty liver disease? A healthy liver contains some fat, but when fat makes up more than 5 to 10% of the liver's weight, it becomes a concern. Did you know that nearly 1 in 4 people worldwide have fatty liver disease, and most don't even realize it? It's a silent threat that could lead to serious liver damage if ignored. Fatty liver disease, also known as hepatic stenosis, is a condition where excess fat accumulates in the liver. While having some fat in the liver is normal, when it exceeds 5 to 10% of the liver's weight, it can cause inflammation and lead to serious health complications. There are 2 main types. Number 1, non-alcoholic fatty liver disease, NAFLD. Number 2, alcoholic fatty liver disease, AFLD. Non-alcoholic fatty liver disease, NAFLD. This is the most common type, not related to alcohol consumption. Alcoholic fatty liver disease, AFLD. This is caused by excessive alcohol consumption. In both cases, too much fat in the liver can lead to inflammation, scarring, and even liver failure if left untreated. The good news? Fatty liver is often reversible with the right lifestyle changes. In this video, we will briefly discuss the causes and risk factors of fatty liver. So first of all, we will discuss that. What are the causes of fatty liver? Let's break it down. First major cause of fatty liver is obesity. Obesity is one of the strongest risk factors for fatty liver disease. Excess body fat, especially visceral fat, fat around the abdomen, can lead to fat buildup in the liver, increasing the risk of non-alcoholic fatty liver disease, NAFLD, and its severe form, non-alcoholic steatohepatitis, NASH. Poor diet. A poor diet is one of the biggest contributors to fatty liver disease. Consuming excessive unhealthy fats, refined sugars, and processed foods forces the liver to store excess fat, leading to non-alcoholic fatty liver disease, NAFLD, and, in severe cases, liver inflammation. Sedentary lifestyle. A sedentary lifestyle, one that involves little to no physical activity, is a major risk factor for fatty liver disease. Lack of movement slows down fat metabolism, increases insulin resistance, and contributes to weight gain, all of which promote fat buildup in the liver. Lack of physical activity can worsen the condition. Alcohol consumption. Excessive alcohol consumption is a major cause of fatty liver disease, leading to alcoholic fatty liver disease, AFLD. Over time, alcohol damages liver cells, impairs fat metabolism, and triggers inflammation, which can progress to liver scarring, cirrhosis, or liver failure. Even moderate drinking can lead to alcoholic fatty liver. High blood sugar. High blood sugar, often associated with insulin resistance and diabetes, is a major contributor to fatty liver disease. When blood sugar levels remain high for long periods, the liver converts the excess glucose into fat, leading to non-alcoholic fatty liver disease, NAFLD. High cholesterol. High cholesterol is another key factor that contributes to fatty liver disease. Elevated levels of LDL, bad cholesterol, and triglycerides can lead to fat buildup in the liver, resulting in non-alcoholic fatty liver disease, NAFLD, and potentially progressing to more serious liver conditions like non-alcoholic steatohepatitis. After discussing causes and risk factors, let's discuss the symptoms how we will understand that we suffering from fatty liver disease or not. Fatty liver is often called a silent disease because it may not show symptoms in the early stages. However, as it progresses, you might experience. If you are facing any symptoms, consult to your doctor and get some lab test that your physician suggests you. Fatigue is a common and often overlooked symptom of fatty liver disease, especially in its early stages. People with fatty liver disease often experience feeling tired, sluggish, or drained, even after a full night's sleep. This is because a fatty liver impairs the liver's ability to detoxify the body, regulate blood sugar, and metabolize fat efficiently, leading to overall low energy levels. Abdominal discomfort is another common symptom of fatty liver disease, especially as the condition progresses. The liver is located on the right side of the abdomen, and when it's affected by fatty deposits or inflammation, it can cause a heavy, bloated, or uncomfortable feeling in the abdominal area. Jaundice, yellowing of the skin and eyes. Jaundice, characterized by the yellowing of the skin and eyes, is a more severe symptom of fatty liver disease and often indicates advanced liver damage. The liver is responsible for processing and clearing bilirubin, a waste product produced during the breakdown of red blood cells. When the liver becomes damaged or inflamed, it struggles to perform this function, causing bilirubin to build up in the bloodstream, which results in the yellowish tint. Swelling in the legs and abdomen, also known as edema, is a more advanced symptom of fatty liver disease and can signal serious liver complications like cirrhosis or liver failure. When the liver is unable to function properly due to fat buildup, inflammation, or scarring, it can affect the body's ability to regulate fluid balance, leading to swelling. After symptoms, we will discuss the methods that doctors use to detect the disease. Blood tests are essential tools for diagnosing fatty liver disease and monitoring its progression. One of the key aspects that doctors focus on is the measurement of liver enzymes, which can indicate liver inflammation or damage. Elevated levels of these enzymes often suggest liver dysfunction or the presence of conditions like non-alcoholic fatty liver disease, NAFLD, or non-alcoholic steatohepatitis. One of the most commonly used imaging techniques for evaluating liver health is ultrasound. It is a non-invasive and painless procedure that helps doctors visualize the liver and detect abnormalities like fat accumulation or cirrhosis. MRI, magnetic resonance imaging, is a powerful and detailed imaging technique that is used to evaluate the liver especially when a more precise assessment is needed for fatty liver disease, FLD. Unlike other imaging techniques, MRI does not use radiation, making it a safe option for repeated use. It provides high-resolution images of the liver structure and can be used to detect and quantify fat within the liver, as well as assess the extent of liver damage. CT scans, computed tomography, are advanced imaging tools that can be used to assess liver health in individuals with fatty liver disease. While not the first-line diagnostic test for fatty liver, CT scans provide detailed cross-sectional images of the liver and are particularly useful when further evaluation of liver abnormalities is needed. Here's a closer look at how CT scans are used in diagnosing and monitoring fatty liver disease. A liver biopsy is one of the most definitive diagnostic tools used to evaluate liver health and assess the severity of fatty liver disease, FLD. It involves taking a small sample of liver tissue for analysis, which helps determine the extent of fat accumulation, the presence of inflammation, and the level of fibrosis or cirrhosis. While it is an invasive procedure, it provides detailed and accurate information that can guide treatment decisions and help assess disease progression. Early detection of fatty liver disease is critical because it can prevent the progression to more severe liver conditions, such as cirrhosis or liver cancer. Fatty liver disease, especially in its early stages, may not cause noticeable symptoms, making it easy to overlook. However, with the right screenings and regular monitoring, liver health can be preserved, and the risk of complications can be significantly reduced. The treatment for fatty liver disease largely depends on the type and stage of the disease. While there is no specific medication approved for non-alcoholic fatty liver disease or non-alcoholic steatohepatitis, the primary approach focuses on lifestyle changes and management of underlying conditions. Home remedies for fatty liver management. While lifestyle changes and medical treatment are essential for managing fatty liver disease, certain home remedies and natural approaches can complement conventional treatments and help improve liver health. Adopt a healthy diet. Key foundation of a healthy diet for fatty liver disease includes whole foods that are rich in fiber, healthy fats, lean proteins, and antioxidants. Whole grains, brown rice, oats, quinoa, barley, and whole wheat bread. Vegetables, leafy greens like spinach, kale, and broccoli, as well as carrots, cauliflower, and sweet potatoes. Fruits, apples, berries, pears, oranges, and bananas. Legumes, beans, lentils, chickpeas, and peas. Avoid processed foods. Processed foods are a major contributor to fatty liver disease and can exacerbate the condition. Foods made with refined flour, such as white bread, pasta, and pastries, are quickly broken down into sugar, contributing to fatty liver. Candy bars, cakes, cookies, and other sugary snacks are high in refined sugars and unhealthy fats that promote fat accumulation in the liver. Limit the sugar usage. Sugar consumption, especially refined sugars and high fructose corn syrup, is a key contributor to the development and progression of fatty liver disease, FLD. Excess sugar intake can lead to insulin resistance, increased liver fat, and liver inflammation, all of which worsen the condition. Take healthy fats. Include sources of omega-3 fatty acids. Omega-3 fatty acids are essential fats that provide numerous health benefits, especially for individuals managing fatty liver disease. These healthy fats are known to reduce liver fat, decrease inflammation, and improve insulin sensitivity, all of which support liver health and overall well-being. Fatty fish are among the richest and most bioavailable sources of omega-3 fatty acids, specifically EPA eicosapentaenoic acid and DHA docosahexaenoic acid. These long-chain omega-3s are highly effective at reducing liver fat and inflammation. Salmon, wild-caught, is the best option. Aim to include fatty fish in your diet at least 2 to 3 times a week for optimal omega-3 intake. Flax seeds are a great plant-based source of ALA omega-3s. Flax seeds also contain fiber and lignans, antioxidants, that help reduce inflammation and promote heart health. 1 tablespoon of ground flax seeds contains about 2.3 grams of omega-3s. Walnuts are a rich source of ALA, providing about 2.5 grams of omega-3s per ounce, about 14 halves. They are also high in antioxidants, which help reduce oxidative stress and inflammation in the liver. 1 ounce, 28 grams of walnuts provides about 2.5 grams of omega-3s. Reduce saturated fats. Cut back on red meat, butter, and full-fat dairy products. Saturated fats can contribute to the progression of fatty liver disease by increasing liver fat accumulation, inflammation, and insulin resistance. These unhealthy fats, commonly found in red meat, butter, and full-fat dairy, can exacerbate the condition, leading to more severe liver damage. Mediterranean diet. This diet, rich in olive oil, nuts, fish, and whole grains, has been shown to improve liver health. Olive oil is the primary fat source in the Mediterranean diet. It's rich in monounsaturated fats, particularly oleic acid, which has been shown to reduce liver fat, inflammation, and improve insulin sensitivity. Benefits for fatty liver disease. Olive oil can help reduce liver fat and lower inflammation, 2 critical factors in managing fatty liver disease. Fatty fish. The diet emphasizes the consumption of fatty fish such as salmon, mackerel, sardines, and trout, which are rich in omega-3 fatty acids, EPA and DHA. Benefits for fatty liver disease. Omega-3 fatty acids have anti-inflammatory properties and can help reduce liver fat, improve insulin sensitivity, and protect the liver from further damage. Lose weight gradually. Losing weight gradually is one of the most effective and sustainable ways to reach your health goals. Quick weight loss methods can often be unsustainable and may lead to regaining the weight, or worse, causing harm to your metabolism and overall health. Gradual weight loss focuses on making long-term changes that support a healthy lifestyle and help your body adjust to weight loss without stress. Exercise regularly. Engage in at least 30 minutes of moderate exercise, like brisk walking, cycling, or swimming, most days of the week. Aim for 30 minutes of moderate exercise most days. Activities like brisk walking, cycling, swimming, or light jogging can be very effective for weight loss while being gentle on your body. Mix cardio and strength training. Incorporating strength training, e.g., weightlifting, resistance bands, or bodyweight exercises, at least 2 times a week helps preserve and build muscle mass, which is key for maintaining a healthy metabolism. Limit alcohol consumption. If you have fatty liver, it's best to avoid alcohol completely, as it can worsen liver damage. If you have fatty liver disease, it's crucial to be mindful of alcohol consumption, as it can significantly worsen liver damage. Alcohol puts additional stress on the liver, making it harder for your body to process fats, toxins, and other substances. In cases of non-alcoholic fatty liver disease or non-alcoholic steatohepatitis, drinking alcohol can accelerate the progression of the disease, potentially leading to cirrhosis or liver cancer. Stay hydrated, drink plenty of water throughout the day to support liver function and overall health. Incorporate liver-friendly herbs and supplements. Milk thistle contains silymarin, which may help protect and repair the liver. Turmeric. Curcumin, the active compound in turmeric, has anti-inflammatory and antioxidant properties that may benefit liver health. Green tea. Rich in antioxidants, green tea may help reduce liver fat and inflammation. Vitamin E. In some cases, vitamin E supplementation, under medical supervision, can help reduce liver inflammation. Manage underlying conditions. Control diabetes, high cholesterol, and high blood pressure, as these conditions can worsen fatty liver. Avoid toxins. Limit exposure to environmental toxins and chemicals that can harm the liver, such as pesticides and certain cleaning products. Get enough sleep. Poor sleep can contribute to weight gain and insulin resistance, both of which can worsen fatty liver. Monitor your progress. Regularly check in with your healthcare provider to monitor liver health through blood tests and imaging if necessary.